हेलो रोशन।
हेलो, एम आई ऑडिबल? हेलो।
हाँ, आवाज आ रही है।
हाँ जी। ओके ओके।
रोशन, स्लाइड अपनी शेयर कर लो।
हेलो। हेलो।
हाँ, स्क्रीन शेयर कर लो ना अपनी।
हाँ सर, मैंने शेयर कर रखी है, एक मिनट। हाँ सर, अभी विजिबल है?
मैं शायद मोबाइल से हूँ तो मुझे तो नहीं दिख रही, लेकिन
ओके। और पार्टिसिपेंट्स जिन्होंने ज्वाइन किया है, ओके। एनी अदर
लेकिन
पार्टिसिपेंट? हाँ,
वो बोल नहीं सकते, उनको बोलो चैट में ही वो लिख,
चैट
मतलब
में,
वो
हाँ
कर।
सर, चैट। ओके सर, ओके। ओके। वैसे मैंने शेयर कर दी है तो विजिबल होना चाहिए। ओके सर, मैं एक बार चैट सेशन में पूछ लेती हूँ। वी कांट सी, ओके फाइन। Any participant can respond. Is the presentation visible? Still, it's not visible.
रोशन, पहले शेयर पे क्लिक करो। शेयर पे क्लिक करने के बाद वो विंडो मांग रहा होगा तो।
हाँ सर, वो मैं कर रखी हूँ, वो मैं ओपन।
हाँ, लेकिन
लेकिन
इसको सिलेक्ट करके, तुम्हें सिलेक्ट करके डबल क्लिक करना पड़ेगा जब वो मतलब वर्क करेगा।
यस सर। इज इट विजिबल?
हाँ, अब आ गई है। ओके।
ओके ओके सर, ओके फाइन। आई विल स्टार्ट बाय 3-5 सर, ओके। So very good afternoon to all the participants present here. Once again, it's Dr. Roshan, PhD in Human Nutrition with minor in Food Technology. And today we will be discussing on the lactation, and it will be the second session of second module, that is lactation. So today we will be discussing about the challenges of lactation with the observation aid that will be necessary and can prove to be a necessary tool for the health workers, as well as the assessment of proper lactation. We will be also talking about galactogogues and some fictions versus facts. Okay, so starting with my session, hopefully I'm audible to all the participants.
यस
Anybody in
रोशन।
the chat section? Okay. So starting with the challenges that we face in the lactation period. First of all, first thing we'll discuss about nipples. As we all know that the milk ducts, when the milk ducts are not empty within the breast, then the breast feel engorged and swollen as well as painful. It is usually seen within the first few weeks of breastfeeding. It is very much possible if the baby is not latching with the breast properly. If the attachment is not proper of the baby to the breast of the mother, then we can see this problem very often, especially in the first few weeks of breastfeeding. So that, so health workers should ensure that the mothers have proper latching and the baby should attach properly with the mother. And while breaking the attachment, while removing the baby from the breast, the suction of the baby's mouth should be removed properly by inserting one small little finger in the baby's mouth. If the suction is not, if the baby is removed abruptly from the mother's breast, then also the problem of sore nipples is arise. And this problem of sore nipples can be relaxed by using ice bag or some frozen peas bag against the nipples temporarily to ease the comfort. The other thing which the health workers can tell the mothers to ease the problem of sore nipples is to keep the nipples dry after feeding the baby, and between the intervals the mothers should clean the nipples properly as well as dry them. so that this problem does not occur very frequently. And if the nipples are sore, then the mothers should be sure to nurse with each breast fully enough to empty the milk through the duct. If the breast is not emptied properly, then also this problem can occur. So the health workers can guide the mothers and make them aware then that how they can reduce the problem of sore nipples through proper attachment and proper removal of the baby from breast, and from the holding the ice bag on the breast, as well as keeping the nipple dry, can remove the problem of sore nipples. The second problem which the mother faces while lactation is dry and cracked nipples. To avoid this problem, the mother should avoid extensively perfumed soaps or creams or lotion that are having alcohol in them to put on their nipples. The mothers can also use dry pads or bra pads to keep the nipples dry as well. Some ointments can also be suggested by some doctors to remove the problem of dried or cracked nipples. Another, mothers, especially the mothers who are bearing a baby for the first time, they are worried that they are producing enough milk or not to feed the baby properly. It is a journal rule that the baby who is wetting 6 to 8 diapers a day is most likely to get enough milk as per his or her age and requirement. So it is best not to supplement the breast milk with any sort of other milk like formula milk or cow's milk, and in fact plain water, so that to increase the amount of milk that a mother is providing to the baby. Mothers produce properly enough milk irrespective of any other, if some physiological condition is there, then it may be the case that the mother is not producing enough milk. Otherwise, if no physiological condition, pathological condition is there, then the mother provides enough milk for a baby for its general requirement, for its proper growth and nutrition. So mothers should not worry. The health workers should counsel the mothers that they should not worry that they are producing proper and enough milk or not to feed the baby. Good nutrition, plenty of rest, and staying well hydrated can positively affect mothers to produce proper amount of milk as well. Your body needs frequent and regular demand of baby's nursing to keep producing milk. Like, as we know that the mother secretes the milk due to letdown reflex, and it is initiated by the touch of a baby because of the sensory impulses. So the continuous nursing of the baby is very much essential to produce enough milk. Some women mistakenly think that they can't breastfeed if they have small breasts, but it is not an issue if the size of the breast does not affect the amount of milk a mother produces. Moving towards another sort of issue which mothers think, especially a working mother, that is pumping and storing milk. The breast milk can be extracted by hand or pump in case a mother wants to start going to her office. Then the mother had to keep her milk, extract the milk and keep the milk in fridge or refrigerate the milk in proper conditions, so that the baby can be fed after several time till the mother is back from the office, or if not office, if the mother is going somewhere else and keeping the baby, not taking the baby with her, then it's very easy to extract the milk by hand or by a pump and keep it properly for 6 to 8 hours in a fridge. And if she can refrigerate it, that it can go for 2 days as well. So it is very useful for a working mother and her baby to be properly nourished. It may take a few days or weeks for the mother to get used to this practice, and a practice is usually required for this process. Like a mother has to, a health worker should guide the mother and can guide the mother for proper extraction of milk by hand or pump, so that she is comfortable with the process and can handle it in a better way. Thawing breast milk directly upon the heat is not very much required or it's not a normal practice, because the nutrients can get hampered while we are directly boiling the human milk. Then it is said that double boiling method can be used in this case. And the bottle that is holding the breast milk can be put into the bowl of warm water, and then it can be brought to a normal temperature and can be fed to the baby. Especially the breast milk which is stored in the refrigerator should not be heated in microwave, because it tends to destroy some immunity boosting qualities and cause the fatty acid proportion of the breast milk to react in a other way, and it degrades. So double boiling method is best to thaw the breast milk. One another problem which the mother faces, sometimes some mothers faces, are inverted nipples. The nipple which does not poke outside or forward is said to be an inverted nipple, and due to some practices, like some doctors and physiotherapists guide and recommend some practices to the mothers that can help the mothers to guide their nipples in a forward motion, so that the baby can be fed well. So a health worker, if a health lady come to a health worker for this a lady come to a health worker for this issue, then the health worker can guide the lady to a proper health professional, a doctor or a physiotherapist, who can guide several exercises, or can guide the lactating women with several tips that allow the women with inverted nipples to breastfeed successfully. Another very important issue, which usually some of the mothers face, is breast engorgement. Full breasts are very much required during pregnancy and lactation. But when the milk is not extracted properly from the breast, then it starts to have engorgement. The fluid is trapped in the breast, and the breast may feel hard and painful as well as swollen, because of the fullness of the blood vessels for a longer period of time. So it is said that alternative heat and cold temperature should be useful for the mothers with breast engorgement. Like, for example, if the mother is having such type of issue, then she can use hot pads and ice pads and hot showers alternatively to relieve the mild symptoms. But in case the symptoms are very much on the higher side, then the mothers should go to the doctors for proper consultation. If there is breast engorgement, then the mothers can also use breast pump or expression of hands to release the milk from the breast. So if a mother comes to a health worker with such issues, so for mild symptoms, the health workers can tell the mothers then she can use hot and ice temperature, hot and cold temperature simultaneously to relieve the mild symptoms. And expression of milk by hand and breast pump can also be suggested by the health workers to the mothers. Then again, the next problem which mother face are blocked ducts. Sometimes a single sore spot on the breast, which may be red in color and hot, can signal a plugged milk duct. This can often be relieved by warm compressions and gentle massage over the area to release the blockage. And similarly, more frequent nursing can also help. Like if a mother is feeding her baby or after 4 to 5 hours, then she can use or frequent nursing methods also, like feeding a baby is fed after 3 to 4 hours normally, but in between also she can just express the milk through her hands or the breast milk pump to release the breast properly. It can help to suppress the problem of blocked ducts. Then one very serious condition of the breast infection is mastitis. It is very occasional, due to some bacteria which enters the breast through any cracked nipple that after breastfeeding. If the mother is not keeping proper hygiene and after feeding, no proper cleanliness is not maintained, then in very rare cases, sometimes a cracked nipple can offer several bacteria and it can cause breast infection. It has symptoms like flu-like symptoms like fever, fatigue. Then in these cases, a health worker should tell the mother that she should consult the doctor for proper medication, and especially antibiotics are prescribed by the doctor for clearing up this infection. Because if the mother is most likely to continue to breastfeed with this infection to the baby, then it can cause problem to the babies as well. Then, in this case, it is also suggested to apply moist heat to the sore area 4 to 5 times for 10 to 20 minutes each time. Then again, mothers, breastfeeding mothers are often sometimes stressed, and this stress can interfere with the let down reflex, because relaxation is the key and is the key to relaxation is the key to proper breastfeeding, and staying relaxed is very much important for a mother to calm down herself, as well as it the process will be more easy. The let down process will be more easy, and the baby will also be calm when the proper amount of milk is released from the breast of the mother. And if the mother is not relaxed herself, then it is very difficult to psychologically, as we know, the signal impulses are all neural process. Then if the mother is not relaxed, it is very much difficult for a mother also to have a proper let down of milk, and the baby will also be not getting proper amount of milk. Then the baby will also be not calmed. So a mother's body naturally release milk into the ducts, and it is triggered by the hormone. But by this stress, if the mother is in stress, then this letdown is not proper and the milk will not flow easily. So relieving from the stress is very important parameter that a mother should follow upon while feeding the baby. I think the slide is not moving. Just wait a minute. Yes, fine. Then, if the mothers who are having premature babies, it is also a difficult process to lactate the premature baby. So, in some cases, mother can release the breast milk through breast pump or expression of hand and feed it through a bottle or feeding tube. Because specifically in premature babies, the suckling reflex is very much hampered. The babies are not able to suckle properly because they don't have that much strength to suckle properly. So in that case, the mother is suggested to release the breast milk through breast pump or expression of hand and feed the baby through bottle or feeding tube. There are some warning signs as well. As we know that breastfeeding is a natural and healthy process. But if we see that breasts are becoming usually red, swollen, hard, or sore, then the health professionals, health workers should guide the mothers that they should directly consult to a doctor, because it can be very much dangerous for a mother as well as the baby. Any unusual discharge from breast or bleeding from the nipples, it can also be harmful, and directly our doctors need to be consulted. If the baby is not gaining weight after proper feeding also, and a mother is feeling that the baby is not getting enough milk or she is not producing enough milk, then also they can consult the doctor. These are some signs of successful breastfeeding. Initially, when the baby is born, it feeds 8 to 12 times a day. That is, within 24 hours, a baby will feed 8 to 12 times. Starting from the fourth day of the baby's life, the baby will wet 5 to 6 nappies with urine, and should be expected that 5 to 6 nappies will be wetted in 24 hours, in the due course of time of 24 hours. From the fourth day till the age of approximately 5 to 6 weeks, a baby is expected to release at least 3 to 4 yellow liquid bowel movements in a day. The nipples and the breast, they does not hurt while breastfeeding if the mother is feeding the breast milk, is feeding the baby properly, and the attachment is proper, then the nipples and breast don't hurt and don't show any signs and symptoms of engorgement. Suckling can be felt at the rate of approximately 1 suck per second. The baby swallowing sounds can be heard. These signs are very normal, and these signs are signs of successful breastfeeding. Baby feeds from one breast until he or she releases the nipple. If the baby is satisfied and have a full tummy, then he or she will release the nipple herself or himself. After a break, the other breast should be offered. Breasts are softer after breastfeeding. A mother will feel that before the breastfeeding, breasts are seen to be fuller and on the heavier side, but after the breastfeeding, the breasts are normal, feel very lighter and softer. The baby is content on completion of breastfeeding and going up with the weight. A baby's weight, as per the growth charts, when we will be discussing upon the growth charts, then the health workers, the health professionals will know properly, you people will know properly that at what pace in the life of a baby, proper amount of weight and proper amount of height, what is the proper amount of weight and height that is to be increased within the proper course of time. So then we can relate to this thing, that if the baby, we can relate from the growth chart, then if the baby is breastfeeding properly, then he or she will be going up upon the weight as well as height in a normal graph. Here I want to show a breastfeeding observation aid, which a health worker can follow to check whether a breastfeeding mom is feeding properly to a baby or having any difficulty to feed her baby. Here we can just fill upon mother's age, date, baby's name and age. And on the left side, we can see the signs that breastfeeding is going well, as well as on the right side, we can see the signs of possible difficulties. So in general, when we talk to the mother will look healthy, mother will look relaxed and comfortable, and there will be signs of bonding between mother and the baby. These signs are symptoms, these signs are like signs for breastfeeding that is going very well. But if the mother looks ill or depressed or the tense and uncomfortable, then it is seen that there is possible difficulty in the process of breastfeeding. Now, seeing the baby will calm and relax, and the baby will herself or himself reaches to root for the breast if hungry. These are very normal signs of proper breastfeeding. But if the baby is restless or crying each time, and the baby does not reach out for the breast or root properly, and doesn't show proper signs of attachment to the breast, then there is possibility of non of breastfeeding not happening properly. When the breast will look healthy, no pain or discomfort or redness is there on the breast, and the breasts are supported as well with the fingers during the process of breastfeeding, then these are the signs that breastfeeding is going very well. But if the breasts look red, swollen, or sore and hard, or the nipple is painful, and the breast with fingers on areola away from the nipple, the breasts are not held properly, and these are held from the areola, that means proper attachment is not there. These are the signs that there is a difficulty in breastfeeding. The baby's position should be as such that the head and the body of the baby should be in line, and the baby is held very close to the mother, so that the baby's whole body is supported by the mother, so that the baby not have to indent towards the breast of the mother, and the body is very much supported by the mother, and so that there will be ease of reaching the baby to the mother, and the nose is attached to the nipple. So these are the signs of proper breastfeeding. But if the head or neck is twisted while feeding, The head is not very much closed. The baby has to reach out to the mother for feeding, and the attachment is only through nipple. Then we can say that these are not the signs of good feeding. Baby's attachment should be as such that more areola is visible on the above side of the breast than the lower side. Lower side, no areola should be visible, and the whole areola should be covered by the baby's lips. The baby's mouth should be wide open while attachment, and the lower lip turns outwards. The baby's chin should touch the breast. These are the signs of proper attachment while breastfeeding. But if more areola is seen from the below side of areola, below lip, and the baby's mouth is not wide open, the baby is only attaching to the nipple, and the chin is also not touching the breast, then we can say that the baby is not attaching to the mother properly, and these are not the sign of proper breastfeeding. If the baby is sucking through deep suck with some pauses, and the cheeks are round while sucking, and the baby releases the breast when finished himself or herself, then this is a sign of proper suckling. But if the baby is not sucking in a proper motion and some rapid shallow sucks are there, the cheeks are also pulled in when sucking, and that means when the cheeks are pulled in, that means the baby has to put very much efforts to suck in. That means the baby is not attached properly and is not sucking properly. Then I would like to discuss some assessment parameters through which the health workers can assess that the breastfeeding is proper, the lactation is proper or not. Here we can see that there are some signs on the left side that the breastfeeding is going well, and these signs and symptoms can be checked upon with the breastfeeding mother to see that the breastfeeding is going properly or not. Firstly, the babies should feed 8 times or more in 24 hours. And the proper course of duration of feeding a baby stands for 10 minutes to 40 minutes at each feed. The skin color of the baby should be normal, and the baby is generally very calmed and relaxed while feeding, and it's contained after the feeding is over. The baby will remove himself or herself from the breast because the baby is contained from the feeding. And the baby will wet or dirty nappies, that is approximately 5 to 10 nappies a day. Breastfeeding is very comfortable for the baby and as well as the mother. And when the baby is 3-4 days old or beyond, baby should be able to hear, mother will be able to hear baby swallowing frequently during the feed. These are very normal signs and symptoms that the breastfeeding is going properly. But if a baby is very sleepy and the baby is taking less than 6 feet in 24 hours, that means the baby is not completely taking the feeds and the breastfeeding is not proper. The baby will feed 5 minutes or longer than 40 minutes, less than 5 minutes or longer than 40 minutes. That also means that baby is not able to feed properly. If the baby is falling asleep while feeding on the breast and doesn't finish himself or herself during the feeding process, then also the baby is having some issues with the breastfeeding. If the baby appears yellow, that means the baby is showing some signs of jaundice as well. If the baby comes out of the breast, like comes off the breast very frequently, that means and also refuses to breastfeed, then that also means that baby is having some problem for the during the attachment or during feeding. Baby is not wetting proper amount of diapers as well, that also means that baby is not getting proper feed. If the nipples of the mother or breast are also paining, showing some signs of engorgement, redness, or any kind of irritations, and it also have mother can tell that baby is swallowing any milk when the baby is 3-4 days old. Mother can perceive that thing very well. So these are some signs through which health workers can assess if the baby is not having proper breastfeeding or not, and the mother is having any issues while breastfeeding or not. Here are some charts through which we can see that we can assess the breastfeeding patterns as well, and the amount of proper breastfeeding a mother is having, and the baby is content with it or not. That firstly, the frequency of expression that I have told, we have discussed before, 8 to 10 times with a due course of 24 hours. Timings of expression, if the cluster expressing no gaps of longer than 4 hours, that means between 4 to 6 hours, like 3 to 5 hours, also we can say that mother has to express milk and feed the baby. For stimulating the milk ejection, mother has to attach the baby to her breast. Certain breast massage can also relax the process, and skin to skin contact with the baby is a must. Health workers can also guide the mothers for hand expression of milk, as well the use of breast pump. In case the baby is premature, the baby is having any physiological difficulty in sucking, the reflexes are not very proper for the baby, then health workers can suggest how the mothers can hand express the milk and keep it, store it, and feed the baby through bottle, or use breast pump. Breast condition is also very good parameter to keep a check how the mother is perceiving breastfeeding, and the mother is not having any issues while breastfeeding. If the mother is having any red areas or nipple trauma, then the condition needs to be very frequently consult to a doctor. Good milk flow will let the breast to feel softer after expression, and the milk volume also increases in 24-hour volume at each assessment. Then in case of uh, in case a female is feeding the baby for less than 8 times, that means that there is some problem with the breastfeeding to the mother. There is a problem with the let down reflex, and the mother is not able to produce proper milk. If there are very long gaps, then there can be difficulty in the milk ejection reflex. If the mother is stressed or anxious about anything, that she is not producing enough milk, or she is stressed due to some other reasons, then also this thing can happen. If the mother is having any poor technique of hand expression of milk, as well as the breast pump expression of milk through breast pump, then also it can lead to nipple trauma or breast trauma. Then if the breasts seem to be hard and painful to touch, then this is the evidence of friction or trauma to the nipple. The milk flow, if it is delayed and slow, and the breasts remain full after expression, then also engorgement can happen, which needs to be addressed by a doctor. Milk volume slows to increase or decreasing at each assessment. See, this assessment can be done after a particular period of time to see the growth of mother, how the mother is perceiving the breastfeeding process. Like if in the start, in the first week of the birth of the child, a health worker can fill this chart, can mark the particular particulars in this chart, and then after a particular period of time, like in another week, like after 7 days or 14 days, from the same lady, a health worker can mark these charts to see the assessment, that how well the mother is perceiving the breastfeeding process and how well she is going with that process, and does the progress of the baby is in a proper manner or not. Discussing some about galactogogues. These are basically the you can say the diet, or the particular ingredients in the diet which can be increased in our diet so that the mother can have a proper healthy breastfeeding. Galactogogues are the substances which tends to induce the milk production process in a mother. Firstly, there is wheat flour, and firstly there is wheat flour. Am I audible? Anybody in the chat session? Okay. Okay, fine. Just a minute. I think the slides are hang. Just a minute. The slide is hanged actually. Fine. Yes. So talking about the galactogogues, firstly is the wheat flour, and you can say whole grains because these are rich in calories and protein as well. These are rich in iron, zinc, selenium, and whole whole cereals. These are very rich source of vitamin B as well as vitamin E. They provide ample amount of dietary fiber that will keep the digestive system of a mother healthy. And these are low in glycemic index as well. So whole grains, wheat, and other whole grains like oats can can increase the process of milk production in a lactating mother. Then moving towards another, that is ragi. Ragi is very nutritious and very healthy source of calcium and has high quality proteins enriched with essential amino acids. This calcium specifically strengthens the bones, and it is also rich in iron as well. The dietary fibers keep the digestive system healthy and provides some another benefits as well for the mother. So it boosts the functioning of nervous system due to high levels of tryptophan as well. So ragi is a very important galactogogue which will help to induce proper milk production in a lactating women. Green gram, as we all know, is very important source of essential amino acids, proteins, and have good antioxidant profile as well. It has low low density cholesterol. It helps in reducing low density cholesterol, and it is very rich source of potassium, magnesium, and fibers as well. It is very good source of folate as well. The proper amount of amino acids and the proper profile of amino acids as well as antioxidants keep a mother to produce proper amount of milk as well. Moving towards one another galactogogue, that is banana powder. It is very rich source of potassium and it has prebiotic fiber that aids digestion and increases the absorption of minerals as well. It is high in essential minerals and vitamins including zinc, vitamin E, magnesium, and manganese. It is high in resistant starch that promotes colon health. Banana powder can also act as a very good galactogogue and help the lactating women to produce proper amount of milk as well. Jackfruit seed powder. These are rich in protein, iron, and have dietary fiber that improve the digestive system. It also contains vitamin A that is known to boost the vision, and manganese that is necessary to regulate blood clotting. It also boosts the immunity. Next is moringa powder. It is rich in proteins with essential amino acid and it has very good antioxidant profile as well. It has anti-inflammatory, antifungal, antiviral properties as well, and it boosts the immunity due to the presence of vitamin C. It helps in treating constipations as well, and it is rich in calcium, potassium, and phosphorus. Moringa powder also have serves as a galactogogue and have several numerous good properties that increases the milk production in a lactating women. Moving towards the next, that are fenugreek seeds. These has lubricating properties which help to aid digestion and it improves the production of breast milk. It helps in weight loss as well, and it has polyphenolic compounds that help in reducing liver damage. So fenugreek seeds are very good galactogogues that helps in increasing the breast milk production in a lactating women. Cumin seeds, these are rich source of calcium, promotes digestion and have several antioxidant, anti-inflammatory and anti-cancerous properties. Next are carom seeds. These seeds help to relieve acidity and indigestion as well as it regulate the blood pressure as well and causes antibacterial and antifungal properties. Carom seeds also have galactogogue properties. Sesame seeds are very rich source of calcium and fiber as well, and have B vitamins as well. It helps in blood cells formation and rich in antioxidants. These seeds are also rich source of galactococs. Some another foods to be talked about as galactogogues, we can say that oats, garlic, almonds, methi, that is fenugreek seeds, coconut, poppy seeds, leafy vegetables, gom, sago, and dill seeds are very rich source of galactogogues. The mostly the ingredients, the food ingredients which are having good and essential amino acids and are rich in dietary fiber and several minerals and vitamins are rich source of galactogogues, and these have sometimes like fenugreek seeds, oats, garlic, these have some anti-inflammatory, antioxidant properties as well, which have proper galactogoggish properties. So these can help in producing a mother proper amount of milk. Uh, Talking about some facts and fictions of breastfeeding, like some people assume and say that new moms don't produce enough milk. This is just a fiction and just stated by some people as well. It is not just the case. As it is said that after if the delivery is normal, then a mother should feed the baby within the first hour of the delivery, because the attachment is very much necessary. Skin to skin attachment is very much necessary for a mother and a baby, so that the mother can have a proper let down and the baby will start to have the proper nutrition through colostrum, which is the first milk of the mother, in the first few hours after the birth. It is also said that alcohol helps in milk letdown, but it is not proper saying, because alcohol does not promote milk production. It is actually in some tribes, it is said that barley, the women who are consuming barley like whole grains, those mothers are having a proper letdown and producing good amount of milk in comparison to the mothers which are not having whole grains. So it is just the whole grains, not the alcohol or any other drink that is made out of barley. It is also said that the mothers who are having had and some kind of breast surgeries cannot feed the babies, but it is just a fiction until and unless a mother is trying or practicing to feed the baby after the surgery. There is no way to know that a mother is fit for breastfeeding or not. It is said that breastfeeding breast in the modern era, some women, what they say, that the breast will sag if the women will breastfeed their baby. So it is not a healthy way to treat the baby, because breastfeeding is always very necessary for a baby to feed due to the proper nutrition and immunity boosting properties of the breast milk. So it is just the pregnancy and the age that the breast continues to sag. It does not relate directly with the breastfeeding. Breastfeeding is painful. It is just a fiction. It is only just that if the mother is having any issue such as breast engorgement or any sort of infection, and the attachment of the baby is not proper, then only the breastfeeding is painful for the mother. Otherwise, it is not a painful process. Thank you very much. I would like to answer any questions. The participants, it is open that you can ask any question. Any questions? Food intake for hobbies on over a lactation period of time. Okay, ma'am. It is just that, ma'am, that it is said that, see, the proper amount of calories and proteins that is required during the lactation should be provided to a mother. It is just that we can cut upon the fats or unhealthy food items which a lactating mother is having in the diet. Otherwise, the proper amount, the healthy quality, healthy as a quality of proteins, healthy quality of fats, proteins, calcium, and iron, it is very much required for the mother to have proper feeding as well. Because we know that yesterday we talked about the like day before yesterday in the previous session I talked about the RDA. So in comparison to a journal like normal women, the RDA is on highest side for lactating women due to the higher need of energy, proteins, as well as some other vitamins and minerals in the body to produce milk and have proper lactation process. So for obese women, we can just say that we can cut the amount of unhealthy food items which the mother is having in the form of unhealthy fats or things like that. Otherwise, the calorie needs to be increased, and we can increase whole grains in the diet, proper amounts of dairy products like milk, as well as paneer or chicken we can have in diet, so that a mother can have essential amino acids in proper amount for proper lactation process. Just we can say that obese women can cut the amount of trans fats, reduce the trans fats to zero, and cut the amount of fat which she is having in the diet, and she can have a normal, healthy, whole diet for having proper nutrition process. Any other question? Any other question? So thank you very much, and thank you KNRC Neftum. Thank you, Dr. Komal, for this wonderful opportunity. And I hope this session was fruitful for you all in the practical field. And if anybody is having any further queries, then please mail me or KNRC Niftum so that I can reach out to you people with answers. So thank you so much for this wonderful session. Thank you.
रोशन रोशन जो पोर्टल पे भी एक ऑप्शन दिया गया है अपने क्वेश्चंस रेज करने के लिए, तो वो पोर्टल पे डाल सकते हैं, फिर आपको मैं एक्सेस दे दूंगा, आप वहां पे रिप्लाई कर सकते हैं डायरेक्टली.
Okay, thank you so much. Thank you. If you have any questions regarding this in portal, you can post on portal as well, as I got to know. So I can answer there as well. Thank you. Thank you.
थैंक यू रोशन.
Thank you. Am I audible? Somebody is asking for coconut milk. Yes, ma'am. Coconut milk can be given. Coconut milk can be given to a lactating women. It is just that the right amount is necessary, because sometimes the coconut milk is having saturated fats as well. So the amount can be limited. Otherwise, it is a very rich source of galactogogues as well. So it can be given in proper amount. Any other question? Thank you.